Good morning, good morning. Happy Tuesday, everybody. Happy Tuesday, Stevie.
Hey, how you doing today?
I'm okay. I think we're back to rain.
Yes. Right? Oh my gosh.
Yes.
The rain.
And we don't just get any rain. We get the kind of rain that pours.
When it rains, it pours. Well, that's the truth. That is the truth. And you have to be careful out here on the road and all this kind of stuff. It's wild. It's wild.
Yes.
It's wild.
It is wild. But there's joy in it, right?
Yeah.
There's joy in it.
Rain is very cleansing.
So if you see a sprinkle, fall on your face, just make joy out of that. But there's definitely joy in it.
Yeah.
So what's been going on? What did you do last night?
What did I do last night? Went to bed. I went to bed. I was here for most of the day.
Okay.
And then after that, I went home and did a little bit more work. And then I just made a conscious decision that I wasn't going to do any more work for Monday. I was like, this is it.
That's it.
I'll do the rest tomorrow. And I think that was a big thing for me because, when you're an entrepreneur, you keep going.
Exactly. It's a 24-hour thing, nonstop, even in your sleep. It's going through your head. So I get it.
And we don't get the rest. But I know yesterday you got an amazing massage. And
I did. So I got my joy moment.
Yes.
Right? I went and I got my massage yesterday. I got some of the tension out of my shoulders, so I'm feeling much better.
That's good.
Feeling much better.
That's good.
A much needed stress relief.
And this is good sleeping weather. That's a quick and easy way to get some joy. Take a nap. Naps are free, so
that's it.
I think it's funny because I used to take naps in rain, and then on Sundays after church, I call it supernatural Sunday nap because I go to sleep and just stay asleep.
It just has that effect, especially after the service, right?
Y'all relaxed and all the stuff is washed away.
Exactly. So. Yeah, that's cool. So I'm hoping we don't have this type of weather all week. But if we do, we're going to find joy in it, right?
Absolutely. It's funny. I know Friday is another event back at the Century Plaza Park with Conceited. Her event is Friday. So hopefully it's like no rain, just sunshine. And I can't believe that's the last day of the month. So, guys, get your networking on. And then,
but is her event Friday or Saturday?
The 30th is the 30th.
It's Saturday because I thought July 1st was Sunday. Am I?
We need to look at that. June 30th.
I'm just about positive.
That might be right. Okay, well, we'll go.
But we'll check it out.
That'd be awesome because I sure have to go to Durham on Thursday.
And we'll be right back.
I think it is Saturday.
Hello, I am Zariah Bell. What happens when stories are left out of history? This summer, stories will be put in their proper place. A community of people who built institutions such as the Clayton Memorial Clinic, Burrow Memorial Hospital, Harrison School, Addison School, and many more. We sustain streets such as Henry Street, Gainsborough Road, Patton Avenue, and Gilmer Avenue. Gainsborough Revisited will go into detail with interviews from the people who directly impacted the community of Gainsborough and Northeast. They will give the stories of how their families made an impact on the community and city. They will explain what once was and what happened to it. Churches, businesses, homes were destroyed. Land was taken for what would later be known as urban renewal. Who was responsible? What was taken? Why would this happen? Who benefited? And is it happening today? This documentary was the inspiration of Jordan Bell. Growing up in Roanoke, he wondered why the things his grandmother, aunt, and mother said was in Gainsborough aren't there now. So he started to research. Civil rights, education, law, business, medical, religion, and all have a special story in Roanoke. With the help of many, those stories will be told. Thank you.
Faith for a Cure has a fourfold mission rooted in the cure. We care about the cause. We unite people with people. We partner with researchers in order to provide the most current information for persons living with sickle cell anemia in order to educate and spread awareness about this disease. Learn more about sickle cell anemia at www.faithforacure.org. We're live, but you know I have to have my coffee. So, what's going on, Stevie? You were telling me about junk mail. What is happening with the junk mail? What are they saying?
Well, junk mail, we all know what junk mail is. That's that mail you're like, oh, well, they stopped sending it to me.
Yes.
And so I want to say, before we even start that, we did find out the Conceited event is Saturday, like Erica said. My mind is all on dates. They all a blur now.
That's okay. That's okay.
And it says, I found this article about stop junk mail for good with these 4 steps. So we should try it because it said for good. Okay. And this is for the from the HuffPost. Mm-hmm. And it says 1, opt out of pre-screened credit card and insurance offers. And you can call toll-free number 1-888-5-OPT-OUT. So that's how you do that.
That's good to know.
Yes. And then the second step is tell the Data and Marketing Association to bug off.
Okay.
Much of the junk mail we get is from members of the DMA, which is that association. It's the largest U.S. Data and Marketing Association. So it includes nonprofits and others who market goods and services directly to consumers. So that's the second step. Then ban smaller marketers and prospect catalogs. And it says, while DMA may be the Goliath in the room, there are many scrappy, smaller direct marketers like Valpak. I know I always get the Valpak, the little blue things. And it says, like it says, delivers those blue envelopes filled with coupons and ads from local contractors and companies. Okay. And you can stop them from being sent to you with a few clicks. So that's, and then it says, do it yourself piece by piece. You can reduce the volume of credit offers, catalogs, magazines, offers, donation requests, retail promotions, bank offers, and many other things. So you can just tell them to stop sending it to you. So yeah, so those are the ways. You can also download Paper Karma. It's an app that lets you take a photo of the unwanted mailings with your smartphone and then attempts to do all the unsubscribing work for you.
Oh wow, so that's a lot.
Yeah,
but that's good though. And that's nice that we know that we have those options.
It is.
Right?
Now we could just get those telemarketers to
stop calling.
But yes, I think everybody should go to the HuffPost. I know I'll be going back and like really, because it's a lot more detailed than I have the ability or time to read right now. But it's really distinct in what they're telling you to do. Okay.
So today is going to be Health Tuesday. We're going to talk about several things to do with your health today. We do have the drop-in center here today. They are going to talk about national HIV testing. And we will be back and talk about that in a few minutes. But right now, I'm going to talk about, as far as health, they have a study on CNN, artificial pancreas better controls blood sugars in hospital patients with type 2 diabetes. What do you think about that? What do you think about these artificial body parts now?
I think that everything is just taking over. It's like you better get real knowing about robots and AI and all the stuff. I think, and it's funny because I always relate stuff to movies. It's like, what if Men in Black was real? You know,
it was real?
Yeah, for real. It's like you don't know who's walking around, but I think that it's anything with type 2 diabetes. I'm really keen on finding out more, so I appreciate you sharing that because my daddy has type 2 diabetes.
I know a lot of diabetics, so hopefully, you know, something like that would be helpful for them to know as well.
Yeah.
And then they're also saying use of polio virus in treating brain cancer shows dramatic advance. So that's a good thing. Like my cousin, I have a cousin, he survived brain cancer and stomach cancer.
Wow.
But I'm going to tell you how he survived that. My grandmother sat on his bed and prayed over him.
Wow, amen.
And so to me, there is the power of prayer.
It is. It is.
Power of prayer. I mean, I don't think I've known too many people that have the same kind of faith that my grandmother
Amen.
has had. So.
And that's in belief. Like, you've got to believe you yourself. Like, that your cousin, it was your cousin?
Mm-hmm.
They have to believe for themselves too. Mm-hmm. So the power of prayer and belief connected, then it's unstoppable.
It's unstoppable.
Yeah, you belief. That's why it's saying I tend to listen to a lot personal development in my car, more so than the radio now, because they're just like I have to have those brain breaks.
Exactly.
And really, like, I want to learn something. So you know, it's important. That's amazing. Prayer, belief. Just living a great life. Yeah. Really knowing your status too, like we're about to talk about.
Absolutely. On that note, everybody, we'll be right back.
Who is N. Wesley Pugsley Jr. and Associates CPA?
We are a full-service CPA firm with over 25 years experience in audit, tax, bookkeeping, payroll, including direct deposit, setting a 501c3 nonprofit status, preparing loan packages, and much more. Since tax season is right around the corner, our focus today will be on taxes. We have an A+ rating with the Better Business Bureau.
What sets your CPA firm apart from other CPA tax preparers?
Technology. When I started in public accounting in the early 1980s, there were no computers or fax machines. Everything was face-to-face meetings. With the advent of computers, the internet, and cloud-based software, we can communicate with any client from anywhere in the country. With our portal technology, which is similar to online banking, you just sign into our secure website, upload your tax document, you scan to your C drive, and we prepare your return. We've prepared taxes for over 15 different states in the past 3 years, from California to New York. We have the state tax software for all states. With Skype being on phones and Facebook, we can meet with you face-to-face in the comfort of your home.
It appears times are changing.
I call this the year of enlightenment. Many Americans are seeing the advantages of supporting community-based businesses. We are here to serve you, not just because we're a community-based firm, but because we have the experience. We know we can serve your needs.
How are you giving back?
If you mention the Renaissance Academy when we prepare your taxes, 5% of your tax prep fee will be donated by our firm to this organization. The Renaissance Academy is a program designed to engage middle and high school African American males in a series of college trips, community service, job shadowing, workshops, and events promoting academic and social and financial skills. See their website for more information.
Have you ever asked yourself, how do I show up in the world? How do I leave my mark? How do I get up every day and be the best I can be? It all starts with a mindset. The mindset to keep pushing through all adversity, to wear the titles of confident, self-reliant, and eternally beautiful. It all starts from within. Think, feel, be conceited. Conceited, in partnership with UPL, presents our third annual Networking in the City, Grow Your Network to Grow Your Net Worth, a nonprofit event that will benefit Apple Ridge Farm and UBU Back to School Drive. Hosted by me, Vernice Bell, and my co-host is Justin Hash. Saturday, June 30th, 5 to 9 p.m. Music will be powered by the one and only DJ Kid. Dress to impress. 21 and over are welcome. Bring your business cards. We will have guest speakers and door prizes at Century Plaza Park, 14 Church Avenue, Southeast Roanoke, Virginia, 24011. For more information, you can email us at networkingthecity@gmail.com or call us at 540-353-1000. 888-888-1770 or check us out on Facebook. The third annual Networking in the City Social is not always what you know, sometimes it's who you know.
Just about to have my car.
Well, God have your sip. Thank God for the commercials that got us right about the networking in the city, because that's like human error. But yeah, I gotta be there. I'm speaking, so I'm excited.
Oh, good. What are you going to be speaking about?
I think I'm gonna speak on signature branding, how to really utilize your gifts, skills, talents, and abilities to rock your it factor.
That's awesome.
So
That's awesome.
I need to know when the event is.
So, speaking of rocking it,
Yes.
we have Carl Jones with us today
How you doing?
from the Drop-In Center.
Yep.
And thank you for dropping in at Focus Radio.
Yes.
We are happy to have you.
I'm a fan. I'm honored to be here.
Well, thank you. It's an honor to have you as well.
Thank you. And just like I promised my past co-worker Irene that I would, if they called, I'd be down here.
Aww.
So here I am.
Aw, well, we're glad to have you. We're
right.
definitely glad to have you. So, we're talking about a subject that is touchy for some people, right? Because everybody is not educated on HIV.
Well,
so, why don't you educate everybody as far as HIV and the STDs and things like that?
Okay. Well, I'll keep it as simple as possible without going super, technical and everything. But
Okay.
HIV is let's start with the three letters.
Okay.
HIV,
Right.
human immunodeficiency virus.
Right.
Okay, so with HIV, it does affect only humans. It does attack the immune system, and it is virus. That means once you have it, you have it. It is treatable.
It's treatable, just not curable.
Not curable, yes.
Gotcha.
And with today in 2018, we have PrEP medication available. So you don't have to be diagnosed in order to take those meds, but you do have to have regular testing and talk to your doctor, and communicate with your doctor. HIV can be transmitted through unprotected vaginal, anal, oral sex. HIV can be transmitted if you share injection drug tools, snorting tools also. It's not just with hepatitis C. It can be transmitted through HIV that way.
Okay.
A lot of people still think that you can get it through saliva, which you can't. You can't get it from kissing. You can't get it from sharing, eating after somebody, or if you have somebody that, let me use your fork real quick and do that. You can't get it after that. Bugs can't transmit it. These are the most common things that people get miseducated on. You can't get it from hugging if you have a relative that's HIV positive and you hug them, you're not going to get it that way.
You're not going to get it.
No. And that's like most common things. And of course the most popular one that people always ask me about, yes, Magic still has HIV. So, it's with HIV, there's a lot of common misconceptions and miseducation.
Right.
And that's where the Drop-In Center comes into play. Because if you have questions and stuff, you can call us through our main line and ask those questions.
Right.
And then also, if you are close by, because we're right on Campbell Avenue, you can come by and get tested.
Okay.
It is a rapid test. It's a finger stick test. All I need is really just this finger right here for like 1/10 of a second. Take a blood sample, very small blood sample. Our test offers not only just HIV antibody testing, but also HIV antigen testing. So that means 30-day early detection with antigens, up to 3 months detection for HIV.
Okay.
So, and it's only a 20-minute test. So if you are taking your lunch break and you need to get a quick test, with paperwork and everything, 20-25 minutes,
Right.
you can come in and get tested. Now, of course, if we do get a preliminary positive test, then it may take a little bit longer.
Of course.
But you're not going to get It's not going to be rushed. We're going to go at your pace. We're going to make you completely and totally feel comfortable when you walk in that door. You know, unlike where you may feel like you're being judged when you go to your doctor, or you know, emergency rooms where you got to wait hours and hours. We try to get you in and out. But if there is a positive, we are there to help. We are there we have all access services right there and referral services right there at the drop-in center.
So are you saying you get your results?
Yes, you get your results right then and there. So whether it's negative or positive, and
you're going to know before you walk out that
That's amazing, because
door.
I know back in the day, it
2
wasn't
weeks.
it
used to take 2 weeks.
It was like scary to be waiting, like, what's going on?
Yeah, it makes you.
So,
and even we have people that come in and say, "Man, that's the longest 20 minutes I've ever had to wait." And understandable. Yeah, we do ask you a lot of in-depth questions. And to quote one of my past clients, I'm not trying to get all up in the Kool-Aid. Okay, I'm just trying to know what you did in the past year. And the way sometimes, like I explain, is that anything that you do, you know, whether it's when you hook up with people, whatever, think of it like a breadcrumb trail.
Right.
So what we have to do is, when we're asking these questions, is not to be all up in your business, but in order to be nosy, it's just to be able to know what you did, how many people you did, and to get that information so that if there is a positive, at least we have a blueprint of what to follow. And then we can assess, or risk assessment, or assess what risk you have and go from there. So if it is a negative result, hey, increase your condom usage here.
Exactly.
Increase your communication with partners. A lot of, especially in the African American community, there's this big, when it comes to communication, there's this big blockage, like a big wall. Especially with women, there's an even bigger wall, because a lot of women are afraid to ask their male partners, hey, have you ever been tested? Do you want to use a condom? And that is a key thing that needs to change. Those numbers have to go down, because I think the last check that I did was 73%. So, and that's for African American females with HIV cases. Now, the one key thing is that there has to be increased communication. And especially with African American males, you have to not be afraid to answer that question.
Right.
And one question that a lot of, especially African American males, do ask, hey, you ain't got nothing, do you?
That can mean a lot of things.
Yeah. and especially a lot of times it's asked in the heat of the moment. That's not a good thing to do. Asking the question ahead of time. Hey, look, I always like to say, use your testing experience as a conversation piece. So saying, hey, you know, a couple weeks ago, I had an HIV test. My test was negative. Had you ever had that done before? That could be one way of opening that door up, instead of just going, hey, you ain't got nothing, do you?
Yeah.
And then if they say yes, then okay.
What are the legalities? So I know, I guess the first question would be, what's the difference between HIV and AIDS for people? And then what's the legality of reporting? Like, if somebody does have it, I know in certain states, I guess all states, you have to tell that information.
Well, in Virginia, yes, we do have an HIV law. I think it is a class 2 felony. You have to have proof of that person is infected. And you can just go down and report to the police. That's the simplified version of it, yes. But anybody that's knowingly infecting people with HIV, I think it's HIV, hepatitis, and I think any STD, they can definitely report that to the police, and then the police has to do an investigation. It may not be like contrary to what you see like on Law and Order or anything like that, where they immediately come busting the door down and come and get you. No. There's a process to it, and they have to investigate and everything. So, yeah. And then the difference between HIV and AIDS is that, okay, one example I like to use is this, that a normal healthy person has anywhere from 1,500 healthy white blood cells. And you know your white blood cells is also your immune system. Now, if your immune system drops 200. So if you subtract 200 from that number, then that can be an AIDS diagnosis. And that's coming from the CDC. Now, maybe off by just a little bit of the numbers, but yeah, that's how it is. And a lot of people, when I explain that, I always use the example of the scene from Straight Outta Compton.
Okay.
When Eazy-E got his diagnosis in the movie. The doctor explained it. I even had to go back and check to make sure the doctor
explained it correctly.
And he did explain it correctly. And I was like, yes, finally, somebody had it right. So yeah, I definitely do use that example, especially when I'm dealing with youth, and they're kind of giving me that look like, I don't understand. Have you seen Straight Outta Compton? Yeah.
Wow.
And then I explain it, and then they go, oh, okay, I get it now. And that's the difference. With the advancement in our testing and stuff, where not only with our testing at the drop-in center, we do also have the take-home testing, which is now available. So even if there's not a drop-in center in your location, there is, if you have a Walmart, a Walgreens, Target, and you have a pharmacy department, they should carry the take-home test. It's about $35 plus with taxes and everything. So it is a decent price to get it, but if you don't feel comfortable, or if you live in an area that you can't really get, your Walmart is closer than your doctor's office, definitely take that test. Now, if you get a positive with that test, then call somewhere like us up, or your local health department, and they'll be able to help
give you resources.
Yeah, referrals and everything to get you in the care. Because that's the key thing. Testing is one thing, but if you do test and you do test positive, one last thing we don't want anybody in any community is to be afraid of coming in.
Right.
Contrary to what any urban myths and stuff you may hear, especially in the streets, there's a lot of rumors and stuff. We're not connected. We do not have any databases or anything with the police. We don't report to the police. That's one common thing. That's why I came up here, is to debunk those rumors.
Exactly.
We are here to help. Contrary to what any kind of conspiracy theories you may hear, it's all fake. We are here to help. We are here to offer services to all communities. To anybody that needs to come in and get an HIV test, come in and get an HIV test.
Right.
We're not here to judge. We are here to help.
Here to help. On that note, we'll be right back, everybody.
I can be every woman. It's all in me. With Brie and B, fashions and accessories.
Children of the Roanoke Valley just can't wait for the fun at Apple Ridge Farm's Summer Academic Camp, all at no cost to qualifying children in underserved areas. This is where Apple Ridge Farm needs you. It costs $800 to send one kid to camp for 3 weeks. Help sponsor a child's unforgettable summer with memories to last a lifetime. Join us as we transform the lives of our community's underserved children. Visit appleridge.org and click on the donate button today. Apple Ridge Farm, serving the community since 1978.
I am LaVon Sanders, and I am WooWee. WooWee stands for Women Helping to Encourage Women, Women's Empowerment. I created this group because I've seen for a long time how we as women treat each other, and I felt a platform was needed where we can have those conversations with one another. We should be able to support each other and be on each other's team. There tends to be a lot of jealousy amongst women, and I just think at the age we're at, it's time to let go of those issues. This is why I created WooWee, and I appreciate everyone's support. Let's continue to ride this journey together. Again, I am LaVon Sanders, a woman helping to encourage women.
The Bradley Free Clinic provides free, compassionate, and high-quality medical, dental, pharmaceutical, and preventative health care services for Roanoke Valley residents who lack the resources necessary to maintain their health and productivity using volunteer healthcare professionals. Check them out on their website at bradleyfreeclinic.com.
We're back. So now we have another guest with us. Let's introduce.
So my name is Tanya Segura, and I work at the Drop-In Center. I work on our comprehensive harm reduction program.
Okay.
And that's mainly focused on the harms of drug use, the negative health outcomes that come along with those behaviors, and what we can do to help people mitigate the risks that they're putting themselves at. For a long time in the United States, we've had like a one-way approach to drug addiction, and that's been abstinence only based programs, and that definitely plays a huge role in responding to this epidemic that we're in the middle of. But we know that the reality out there is that people are using drugs, and they're going to continue to use drugs. And with the opiate epidemic that we're in the midst of, we have seen a real drastic increase in the amount of injection drug use.
Oh, wow.
And that's probably the most dangerous way to use drugs, right? And so with that increase, we've seen a dramatic increase in HIV, hepatitis C cases, endocarditis, septicemia, abscesses. So there's all these really extreme negative health effects that go on with this risky behavior. So it's our goal to meet someone wherever they are on that spectrum of drug use, whether it be abstinence or using injection every day, and offer them some kind of education, some tool, some material that helps them to lessen those risks.
Okay.
We know that we had over 63,000 people die last year from overdoses in the United States.
Yeah.
And that's more than the number of people that died in the 20 years of the Vietnam War.
Wow.
So that's a pretty extreme number.
Huge number.
In Virginia, we had over 1,200 deaths. So part of what we do with the harm reduction program is we offer revive classes, and that's training for opioid overdose reversal with the use of naloxone. And we partner with the health department. They're able to distribute the naloxone for free to people that need it. And we really encourage anyone who, even if you don't have a history of addiction yourself, even if you aren't, having an intimate relationship with someone, just to have it on you, because people are dying in our communities. Yes. And it's on us to respond to this. It's not just on EMTs and policemen, and it's on regular folk. But particularly if you have a friend or a family member that has a history of addiction, that's something that needs to be in your arsenal to address what's going on with them. We know that most of those overdoses could have been prevented if somebody had naloxone around. And it's an easy way to respond. It's a very effective way to respond. There was a state of emergency declared in Virginia, and because of this opioid epidemic.
I heard that. I did. I definitely heard that.
And what that allowed is there to be a standing order for naloxone across the state of Virginia. So basically, every one of us has a prescription. We can go into any pharmacy and get it. The cost can be prohibitive for some people because it's over $100 a lot of times. So that's why the health department distributes it for free, as long as you've been trained. It also legalized syringe exchanges. And that's something that we've really been working towards. We know that in areas that have syringe exchanges, you have people that are 5 times more likely to enter drug treatment. The rates of HIV and hepatitis C drastically decrease. When you're having conversations with these people, you're able to point them to area resources. This is a hard population of people to reach out to, and they're not going into healthcare in a lot of ways. And so when you have that incentive to bring them in, you're able to get them tested for HIV and hepatitis C. You're able to show them where the detox facility is. We've been inundated with new Hep C cases, and more people die every year from hepatitis C than any other infectious disease in the United States.
Oh, wow.
So it's a pretty big deal. And that's not just, we need people to get tested, not just that have injection drug use history, but if you've gotten tattoos in jails or prisons, if you've gotten tattoos outside of any kind of licensed parlor, you're at risk. if you're a baby boomer, if you got a blood transfusion before 1992, there's all kinds of ways to put yourself at risk for that. And just living with someone who's possibly Hep C positive, because it's so contagious and it can live outside the body for weeks. Sharing a toothbrush or a razor with someone that's Hep C positive can put you at risk. We know that they estimate about 3.5 million people in the United States have a Hep C infection, and of those 3.5 million, most of them don't know they have it. Wow. So we've really been trying to do a lot of outreach. Carl and I go out 2 Saturdays a month to some of the riskier areas of our community to talk to people, to offer them the condoms and the Clean Works bags that we do.
Now, a lot of those people that have the hepatitis C, do they have HIV as well?
You have a population that's co-infected, but we have a lot more hepatitis C cases clearly than we do HIV.
Okay.
But most of the people that we test and most of the people that are infected with Hep C, about 70% of them identify IV drug use as one of their main risk factors. And with that risk comes a huge risk to be co-infected with HIV. Right. If you're already putting yourself at risk with behaviors that put you at risk for Hep C, you're definitely putting yourself at risk for HIV. And I don't think we know the real numbers coming out of these communities yet, because people that are currently using a lot of times aren't coming in to get tested. We're catching them at stopping points when they're in jail or when they're in rehab or at the methadone clinic or Suboxone treatment facilities.
Or they lost a friend that overdosed or something. That makes them want to come in and get tested.
Oh wow. So what can we do as a community and as Focus Radio? What can we do besides just have you on the show? What can we do to help people come out there and test more, to get them to understand how important this is to get tested?
We need the community better educated about the risks that they're putting themselves at. Right. We're doing some, we have National Testing Day, Wednesday. We're doing testing at the Walgreens on Williamson Road and on Main Street in Danville from 10 to 7. Carl and I have a program at the Jackson
Library over in Southeast.
Okay.
That'll be in September.
All this tomorrow as well? No.
For Wednesday, we'll be doing at the 2 locations.
Okay.
On Thursday, we'll be having an actual testing clinic at the drop-in center.
Okay.
Our normal hours from 9 to 6. But if you come in and get tested on either day, I think there is an incentive.
Okay.
That you can come in and get tested. Rapid test, like I said, finger stick test. 20 minutes, you get your results right then and there.
Okay.
At both locations in Roanoke and Danville, and at our drop-in center.
Okay.
Also for the clinic that we're going to be doing in September at Jackson Library. That's going to be the same thing, HIV, Hep C testing, and Tanya's going to be doing the harm reduction education and also
the revive
training and stuff for people that can't get access to that.
And we'll also have our Hep C linkage coordinator on hand for anybody that tests positive for Hep C. She can immediately, let them know exactly what they're going to need to do to get treated. Because you can be cured. There's a treatment available for Hep C. But as far as what the community can do, we need to educate ourselves better on why comprehensive harm reduction programs are needed. There's a lot of negative ideas about what a syringe exchange would mean for Roanoke, and the data supports why we want to open one, and we need to educate ourselves on those issues. And I think everybody needs to be trained in Revive and have naloxone. With 63,000 Americans dying, that's something that we can do immediately to help save lives.
Absolutely.
And I just really, I am really passionate about that. I come from a family that has a history of addiction, and it's just almost everybody's been touched by this opiate epidemic. It's like cancer now. Somebody in your family or some friend has been touched by this, and it's on all of us to respond.
Right.
I've had in my lifetime, I've had 2 friends that passed away from overdose.
Right.
So it is something that is slowly like taking over. And a lot of people, because of what it's associated with, drug use, a lot of people kind of kind of tuck it away.
There's a lot of stigma, and that's why people aren't coming in to get tested, and they're not coming in for treatment because they're treated, badly. They're treated like they're just weak-willed individuals, and all the new research is showing that it's a brain disease, and that we need to treat it as such. And a huge part of getting that stigma lifted is us educating ourselves on these issues, realizing why we need to treat this as a disease and not just as a moral failing,
right?
Because that's not gotten us anywhere. And clearly we can't arrest our way out of this problem. We need to figure out how to help people get well, and and how to help them stay healthy throughout their use, because a dead addict doesn't recover, right?
And at the drop-in center we offer all this. We
Right.
have all this readily available.
Now that's the thing. A lot of people are private. They want to be private, but people need to understand that you all will respect their privacy.
Oh yes.
And I understand wanting to be private, but at the same time, once you find out, God forbid, that you are positive, you're going to want to know, what am I going to do next? And that's where you guys can come in and help them and guide them and give them the help that they need.
Yeah, that's what we've always offered. My director, Pam Etter,
Right.
she's the boss of all this.
Right.
She has all trained us to not have that judgmental, look or mindset ever.
Exactly.
When somebody comes in and you help somebody, you're there to help them from beginning to end.
Confidentiality it's an extreme concern of ours. We know that there's a lot of stigma still attached to this diagnosis, and our agency exists to help people manage their result, whether it's positive or negative. If it's negative, we want to help do some risk reduction counseling with you to figure out how you can keep yourself negative. And if it's positive, we're going to get you linked to the care that you need. And with HIV, you can live, like Carl said, you can live a long, healthy life as long as you're taking care of that. And we're there to help you every step of the way through that journey.
Right.
One of my best friends, she's from North Carolina. Well, she lives in North Carolina, and she's vivacious. She's been living with HIV for years now, but she's a speaker or author. She's doing some great things. So I know personally that you can live that life, because I think we all look at Michael Jordan and we're like, I'm sorry, Lord Jesus,
Magic Johnson.
Not Michael. I don't know nothing about Michael. Disclaimer from the PR rep here. I know nothing. Damn. Even if I heard but Magic, I know how to cover my own disclaimer. But yes, we all look at him and we feel like, he has money, so he has the best drugs, and best this and best that. But I know personally, like one of my best friends, she has gotten help from, I think, Ryan White.
Ryan White is huge. They can help cover your medications. They can help get you insurance. They can help with emergency funding for utilities and housing, medical transport, whatever you need to become medically adherent and stay on your meds and get your viral load down to undetectable. Ryan White is going to help you get there. I mean, we have a lot of resources to help people.
And one more thing, a lot of people, when they hear undetectable, that's not they're cured. It means that the virus is no longer, it's not as strong as it was since day one that they were diagnosed. But in order to, a lot of people when they are HIV positive and they get to that level, they're reintroducing new risk and stuff.
Right.
And we're trying, no, keep doing what you're doing. Make sure you do increase your risk. Don't increase your risk, but still be safe about it. Because a lot of people, especially with the PrEP medication that's out now, PrEP is something that's being stressed very much because it is effective. It works. It's up to 90%, effective.
Right.
But you have to take it consistently. It's not like taking 2 aspirin and call me in the morning.
Exactly.
It's something that you have to take once every day. I've met a lot of people that's on it. It's effective and it works. But then also with that, you have to get into a routine of testing every 3 months, or coming to see us or coming to your private care physician and getting that test, and keeping that in check. And then also, having 100% condom usage on top of that.
Right.
Because if the condom fails, then you know that you have PrEP working inside your body to also be
And there's other stuff that you're putting yourself at risk for when you're not using condoms. Because I think some people think, let me use PrEP, I can go ahead and have unprotected sex, I'm protected from HIV. But there's a slew of STDs out there.
All kinds of stuff. Syphilis.
Yeah. Well, and syphilis is making a comeback. They had thought they had almost eradicated it, and now we've got just these insane numbers of new cases coming up. So there's a lot of stuff out there to protect yourself against, and we're there to help you figure out how.
Yeah, that's awesome. On that note, everybody, we'll be right back.
Healthy food for healthier communities. In partnership with Focus Radio and Apple Ridge Farm, the Well Market is a youth-run farm stand providing healthy, local, organic produce to people living in the Northwest Gainesboro neighborhood. Fruits and vegetables such as greens, potatoes, tomatoes, peppers, and squash are harvested from the George Washington Carver Community Garden in Northwest Roanoke and local farms in Floyd County including Patchwork, Green Island, and Apple Ridge Farm. Money raised from produce sales goes directly back into the program and continues to fund youth involvement and entrepreneurial skill development. Please visit the Well Market every Saturday from 9 a.m. until 1 p.m. and help support healthy food for healthier communities. The Well, working, eating, living, and learning together.
I matter because I help people every day learn about their medications and their health, and I matter because I'm a human and every life matters.
I'm like, what? Okay.
We're back. Short break. But thanks for sticking with us, guys. We know that the show has gone over today, but this is really important information that we do want to get out there. National Testing Day is tomorrow. We do want you guys to get out there and go test. You can go to Walgreens. If you don't want people to see you testing, just go on down to the drop-in center. You don't have to go in the front door. You can go in the back door. Just make sure you get tested.
Yep.
And on that note, we're about to end our show today, but we're going to have everybody's final thoughts. So, Tanya, what would you like to get out?
Just thank you guys for having us. I just really think it's important to be having these conversations with the community. These are, uncomfortable things to talk about for a lot of people, but the more comfortable we get, the more safer our communities are going to be. So thank you guys for having us and letting us talk about this stuff.
You're more than welcome. And if you can just repeat one more time, tomorrow, what time and where it's going to be.
So we're going to be at the Walgreens on Williamson Road from 10 to 7, and come out and get tested. You can also get tested at the center on Campbell Avenue. We're going to be there. You guys come out and get tested.
Absolutely. Your final thoughts, Carl?
Once again, thank you for inviting the drop-in center, us into your happy little. Once again, I have to, co-sign on to what Tanya's saying. It's very important to erase the stigma, erase the miseducation, and there's a lot of generational miseducation out there too. So it's passed down from father to son, mother to daughter. Don't be afraid to come by our center. And, we're located at 356 Campbell Avenue, little brick building, and I hate it. I'm not gonna say I hate to use it, but yes, we're right next to the police. But do not, and I'm looking at whatever camera, do not let that deter you from coming in and accessing our services.
Please.
Don't worry about them. Get a little rowdy, worry about them. But for right now, if you need to get tested, for everybody from 13 to 300, come in, get tested. You'll get your results right then and there, and confidential. I can't stress that enough. As soon as you walk in our doors, everything's confidential.
Absolutely.
If you don't feel comfortable coming through the front door, call us, let us know. We'll let you in through our back door access and everything. But if you need to get tested, if you feel you get tested, if you have a friend that's at risk and something's up and they need to get tested, come with them.
Exactly.
Support system is always good for when people need to get tested for either HIV or Hep C. So if you got that sister, brother, best friend, BFF, homie, whatever, still get them to come in. Come with them. We have everything. We don't mind if you want to bring a friend in and get tested. Come in. And especially for couples, anybody, come in. Our door is always open.
Awesome. Good to know. Thank you, Carl, and thank you
guys.
Tanya.
Thank you guys for having us.
both. Thank you. Stevie, your final thoughts for the day?
Yes, thank you all for being here. It's amazing. It's like, I remember back in the day, those 2 weeks were like, oh my God.
Yeah, that's anxious.
But 20 minutes. 20 minutes, I feel like we all can do it. I'm going to definitely, see which place I'm going to go to either tomorrow or Thursday and figure it out, because it's important. I need to know for myself and for whoever else.
Okay,
Yes, sir.
I forgot one more thing. We're all going to be at Danville,
Tomorrow
West
as
Main
well.
Street tomorrow. Danville, Virginia, we're going to have a team going out there, rapid testing, HIV and Hep C. Definitely feel free if you live in the Danville area and you live close to that particular Walgreens, thank you. Between 10 and 7, definitely coming on. Check us out. We'll be able to get you situated.
And they do have a free gift for you too if you go get it done.
Yes, let me go and get that gift. The phone number and email to reach one of you or whoever needs to be reached. That's what someone is at.
Our main line is area code 540-982-2437. Just listen to the operator prompts, and you'll be able to get to me or Tanya.
Okay.
Our email address is mine. This is Carl J. at councilofcommunityservices.org. Tanya.
Mine is TANYAS at Council of Community Services. So Tanya S at councilofcommunityservices.org.
Okay.
Our emails is always on and open. So if you have any questions, or if you're watching this video and you have questions that you want to ask one of us, send us an email.
Absolutely.
My email is always on. So.
Awesome stuff.
And again, if you guys did not get that phone number, the drop-in center is 540-982-2437.
Absolutely.
So please feel free to give them a call. My final thoughts: get tested. It's important for you, for your peace of mind. Don't worry about anybody else. Just worry about yourself.
Absolutely.
On that note, shout out to Roanoke, shout out to Philly, shout out to Jersey, and of course, if your birthday is today, happy birthday to you. Until tomorrow, everybody, God bless.
Make it a great day, y'all.
Conceited, in partnership with UPL, presents our third annual Networking in the City. Grow your network to grow your net worth, a nonprofit event that will benefit Apple Ridge Farm and UBU Back to School Drive. Hosted by me, Vernice Bell, and my co-host is Justin Hash. Saturday, June 30th, 5 to 9 p.m. Music will be powered by the one and only DJ Kid. Dress to impress. 21 and over are welcome. Bring your business cards. We will have guest speakers and door prizes at Century Plaza Park, 14 Church Avenue, Southeast Roanoke, Virginia, 24011. For more information, you can email us at networkingthecity@gmail.com or call us at 540-353-1770 or check us out on Facebook. The third annual Networking in the City social is not always what you know, sometimes it's who you know.